Hello and welcome to the Owatonna Today Show. It is a Monday. We are so glad to have you along. Very chilly, wintry Monday after the beautiful Saturday we had. We hope you had a great weekend. We thank you for joining us today. Of course, you can find us 6 days a week at cable channel 8, I should say, throughout the day, many times 6 days a week. We're also out there on the internet at blip.tv, as well as on YouTube. Be sure to put either the date or Shelley's name or myself on there to get the show to come up. Also, we are on Facebook, and if you like us on Facebook, you will get notification from Leanne as to when each show has been uploaded. Also, if you have not joined us for a while, we are giving away a pair a week to the Steele County Blades Junior Hockey Team. And that's a game of your choice, and we do that throughout the season. To enter, just like us on Facebook, or you can like a particular episode, or you can contact us via email if you want your name in the drawing at Owatonna Today at charter.net. And our winners for this week that have been drawn out are Andrew Munns and Teresa Rundle Thompson. So congratulations, you have yourself a pair of tickets to see the Steele County Blades. Got a great show for you today. We're going to be talking to Julie Anderson, who is with the Steele County Transitional Housing. Very important information we have to pass along. And we're going to be out at the Mayo Clinic Health System-Owatonna. They've tweaked a couple of their programs, and we're going to learn all about that too. So we'll be heading out there on the other side of the break, so stay with us.
I'm Dan Branstead of Carlson Branstead & Company, Certified Public Accountants. We support the Owatonna Today Show.
Owatonna Public Utilities, real people, real reliable, real progress. Making life a little easier day after day, taking pride in our community, listening to what you say, a voice you can talk to. We're growing with you in mind in everything we do. Owatonna Public Utilities.
Hi, this is Laura Ressler greeting you from the Steele County Historical Society's History Center, where we're honoring the past and looking towards the future. We're proud to be a sponsor of the Owatonna Today Show.
Kick off your holiday season with Advocates for Developmental Disabilities 22nd Annual Festival of Trees, Friday, November 16th at 7:30 p.m. at our new location, the Steele County History Center. The opening night gala is a festive evening of sparkling trees, live and silent auctions, and delectable hors d'oeuvres, all wrapped in a gift package of goodwill. Tickets are available at Cashwise, Hy-Vee, and Cockies, or phone 451-9769. Put some merry in your holidays by attending AD's Festival of Trees opening night gala.
We are here at the Mayo Clinic Health System-Owatonna talking with Dr. Diane Wallner. Hello, Diane.
Hello.
Now, Diane has been a doctor here for 15 years.
Yes.
As a general practitioner?
Yep, family medicine.
Family medicine. Now, you, being here 15 years, you're not the only doctor in the family, are you?
No, I actually have a sister that's also here, and my husband is here.
Oh my, you are keeping it in the family.
Absolutely.
And what are their specialties?
Family medicine also. Yep.
Had they been, has your sister been here as long as you?
She, I think, came 1 year after me, so I think she's been here 14 years. She had been up in the cities practicing, and my husband and I moved down here, and I convinced her to come and join us.
So are you from the area originally?
I am from the Twin Cities.
Okay, well that's the area.
Yeah. And my husband's from Albert Lee, so, and his actually father grew up here.
All right, so in Owatonna is just in between, so
yes.
that works out really well for
It does.
And you have a family at all?
I have two sons, Daniel, who is 12, and David, who is 10.
So what made you decide to choose medicine?
My father, he actually was a chemist, but he really wanted to go into medicine, and so he really encouraged my sister and I to pursue the medical field.
Mm-hmm. Were you fortunate enough to do your training in the state of Minnesota, or did you have to go?
Yep, we up at the University of Minnesota.
Okay, so you're able to stay local.
Yeah.
Is that where you met your husband?
Yes, as a matter of fact, yes. We did residency together, and so.
Oh, that's really keeping it in the family. Now you said you have 2 boys.
Yes.
And how old are they?
They're 10 and 12. And
any extra activities?
Oh yes, they like soccer, and right now we're into hockey.
Hockey, yes. Owatonna has really become a huge hockey town.
It has.
And you said that your husband coaches as well.
Yes, he does.
So besides both of you being doctors, and you have two busy boys playing hockey, where do you find the time?
We don't. We have to meet every morning and coordinate our schedules and figure out who's taking who where, and we also have a great nanny that helps us to get the kids to some of those activities.
A big calendar on the refrigerator, which
Yes, we certainly do.
You definitely need that to be organized.
Yes.
So, well, as I was talking earlier to her, I've been a patient here many times too, and was not fortunate enough to run across Diane. So in case some of you are not familiar with her either, we wanted to get acquainted with her. But that's not why you're here this morning, is it?
No.
No, something is changing
here
at the clinic.
Yes.
Why don't you tell us about that?
Well, we have done some redesign of our urgent care. Medicine is changing, as you know, and so we have looked into the way we deliver medicine in our urgent care, and for the last 2 months we really have looked at some of the data over the last 2 years, looked at the type of patient that comes into urgent care, the type of visit, the time, and through some analysis have thought that we're going to do some changes now into our urgent care system so we can hope to deliver medicine probably a little better and a little more efficiently.
And what are those changes?
Well, so first off, the name is going to change, so it's going to become same-day clinic. So in December, the sign will change and it will say same-day clinic.
In December?
Yep.
Okay.
And December 5th is our start date, but when we analyzed the type of visits that come into our urgent care / same-day clinic, about 70% of those visits were kind of the runny nose, the sore throat, upper respiratory, bladder infection. You know, we kind of
things like that.
Yeah, and we kind of call them kind of the quick hitters. They can, you know, they're fairly easy to diagnose and to treat. 30% were more complex things, abdominal pains, and so if you mix those all together, because right now the way our urgent care system runs, it's kind of first come, first serve. It doesn't really matter what you have. We will see everything and everybody, and we get kind of backlogged sometimes. So things that could be seen quicker still have to wait because it was a first come, first serve. So throughout, we looked at even around our communities, you know, Elberly, Austin, Faribault, Waseca, even Rochester, and up in the cities, and looked at kind of the systems that they have. And so what we decided to do was kind of run a non-scheduled part of a same-day clinic and then a scheduled part of the same-day clinic.
And they would call in for an appointment then?
You can call in for an appointment, or you can come. The non-scheduled appointments are basically, there's going to be basically a menu, and you have to fall into one of the criteria in that menu to be able to be seen in the non-scheduled. So it's going to say ear pain, it's going to say an eye infection, a sore throat, respiratory, so there'll be a whole list.
Every part of the body.
Yes, and some people may be familiar with other systems around, like an Express Care or a Minute Clinic. We're sort of pulling a little bit from that, but you know, if you go to an Express Care or a Minute Clinic up in the cities, there's actually a price behind that. We're not doing that type of system, but we're going to have, so kind of you should be able to come in, be seen hopefully in a timely fashion, and leave. So we'll be able, and that's about 70% of the visits that come through our urgent care right now are quote unquote kind of a but we're not. It's not an express care, but it's a kind of a faster type of an appointment.
Yeah,
absolutely.
Now, is this going to require more staff?
I don't believe right now that it's going to require more staff. And then the second half of it is a scheduled appointment. And so if you don't meet the criteria on the non-scheduled, you will be offered an appointment time. And so they will start at 8 in the morning, and they will go through scheduled appointments till 7:30.
7:30.
Yes. And then what we're trying to do with that is that will hopefully be able to offer, you said you see Dr. Oyen at the clinic, and if you call, we'll see if we can't get you in with Dr. Oyen. And if that doesn't work, then we can offer you an appointment in the same-day clinic. But we're going to try to get people back to their primary providers and get the appropriate visits into same day, and those that maybe aren't as appropriate back to their primary provider or to somebody in the clinic.
Okay, that might help with the decision about, okay, do I go to urgent care or do I call my doctor?
Right.
Because there's times you aren't sure, is it serious enough, or might it be this or less? You don't want to bother your doctor if it's just something that might be real slight.
Right.
So this will definitely help with that.
Absolutely.
So now, I imagine it's the same kind of setup with people with insurances. Nothing changes.
Nothing changes. Absolutely, nothing changes as far as that goes. So now, if you walk in, you could like right now, people can just walk into urgent care. So if you walk into urgent care, which will be same-day clinic come December, you will have the two options. One, if you fall into the criteria of a non-scheduled, you can then go into the non-scheduled and be seen kind of that first come first serve. If you don't meet that criteria, you will be then offered an appointment. You can also then call in to the same thing, and you'll either be offered an appointment in that same day clinic or with one of the other providers in the clinic.
So really, you're just kind of bridging the gap in between the regular doctor visits, what you would do, and the urgent care. It's kind of in the middle.
Right, right. We're trying to get the people to be seen where they should be seen.
There's construction going on here. Do they come in the hospital entrance, or do they come in the clinic entrance? Where is it going to be in the same place?
It will be in the exact same place. Yep. And so obviously on the weekends they have to come in through the hospital because that's the entrance. And then during the weekday they have both options.
Okay, because I have not used this building for urgent care, so I wasn't familiar with which entrance you came in. So it is a different entrance on the weekend.
Yes. Yep.
Okay. Okay, well that sounds like a really great idea. And are you going to be one of the physicians at this clinic?
You know, I will have shifts that I get to work there, but you know, we have right now it will be 5 full-time urgent care staff that help that, and then the family medicine on the weekends help cover some of the shifts.
Well, good. I'm glad to hear that transition. Thank you for being with us here today.
Oh, thank you for giving me that time to discuss this.
You're very welcome. Diane Wallner, for I would say our producer's name, Leanne Alt. I'm Betty Johnson. Thank you for joining us.
Hi, this is Barry Gillespie, president of ERA Gillespie Real Estate, where our pledge is to save you money, save you time, and simplify your life. And we're proud supporters of the Owatonna Today Show.
Hi, Ann Plaskanko here from Senior Place. Senior Place has new hours. Mondays and Fridays we're open 8 a.m. to 4 p.m. Tuesdays, Wednesdays, and Thursdays from 8 a.m. to 8 p.m. Participate in Zumba Gold, Bike Club, table tennis, computer classes, speakers, and much more. Don't forget the Senior Place Partnership Program with 39 businesses giving discounts and incentives with your Senior Place membership card. Membership is only $35 for the year, which comes to just $3 a month to be a member. Consider joining us today.
Effective Monday, October 15th, the clinic main entrance will be closed for construction. Please use our temporary entrance, the dialysis stores, and/or the hospital main entrance. We appreciate your patience during our construction, but at the end, we'll have a pleasant entrance that is larger, warmer, and safe for our patients. Again, starting Monday, October 15th, the clinic main entrance will be closed for construction. Thank you.
Do you know how to safely dispose of your expired or unused prescription and non-prescription medications? Not by flushing them down the toilet or putting them in the garbage. Doing so pollutes our rivers, streams, and drinking water supply. Take it to the box instead for safe, secure disposal. It's easy. Bring your unused medications in their original containers to the drop-off locations listed on the screen and drop them in the Take It to the Box drop box. Proper disposal of unwanted medications keeps them out of the hands of children and out of our environment. This is a message from the Safe and Drug-Free Coalition of Steele County.
Hi, I'm Glenn Mager.
And I'm Tim Thomas of the Brick Mager Funeral Home, and we're proud to serve the Medford and Owatonna areas with cremation and traditional funeral services.
And we're proud to be a part of the Owatonna Today Show.
We are back. Our guest now is Julie Anderson from the Steele County Transitional Housing. Hello, Julie.
Hello, thank you for having me.
Yes, and now today even more when we think of the snow flying in that. You do work a lot with, homeless. They're trying to keep people from homeless.
Absolutely, absolutely. Our focus is really twofold. We work with families and individuals who are already homeless by helping them get into an apartment, and we will pay for the first month's rent and deposit. And then ongoing, we will pay for a portion of the rent according to income for that family or individual. And then that family or individual will continue to pay for a portion of their rent ongoing for up to 2 years.
Okay. Now, how long has Steele County Transitional Housing been in existence here in
Since
Owatonna?
2000, since the year 2000, and it began actually with a group of pastors and clergy who were concerned about the number of people they were seeing coming into the churches needing support. On days like today where it's snowy, or this week where it's kind of been a snowy week, people would come in and they'd say, you know, I have no place to live. I'm living in my car, or I'm living on the street. Or they were in a situation where they were continuously bouncing from family to family, staying with anybody who would take them in. And we call that couch hopping. And this was back in the year 2000. This still happens, but this was back in the year 2000. A number of pastors said, look, we can't keep answering this problem without the support of the entire community. So they came up with the idea of starting a nonprofit organization that would help people enter housing and stay in housing, and then receive comprehensive case management to help them stabilize. So in other words, learning how to budget, learning how to pay down on their debt, starting a savings account, making sure that you're working or going to school. So all of those tenets came together, and what happened was we got this wonderful nonprofit agency in the year 2000, became a 501c3 tax-exempt nonprofit, and we've been operating for nearly 13 years.
Now, where do you get, who makes the referrals to you besides churches? Do you get, like, I know people go to the Salvation Army when they need, they need assistance?
Very
or
common.
Social services, so is that where you
hit on the top two right now. That's perfect. Very commonly, we will receive referrals from people who have visited the county human services office, and the type of support that they need is just a little different from what the county can offer. And they'll call us. The other option is oftentimes people will come from Salvation Army, and they'll need help ongoing or even on a one-time basis. We also receive referrals from churches very often. And that's a common one.
Great. It works in conjunction with each other instead of a competition.
Absolutely.
You work together.
Very much. We're in contact with agencies every day.
Now, are you the only person on staff, or do you need social workers on staff?
We do have 2 people on staff, and then we do work with a third individual who is basically provided through a grant. So there is a full-time executive director, and I serve in that role. We also have a full-time case manager, and then we have a part-time administrative assistant through a program called Experience Works, which is a work opportunity for people who are over 55. And this is actually not paid for by transitional housing, but is a federal program.
Because that's getting to be a larger group as the baby boomers are aging.
Right. You're going to find more people going into that group. And we've just been so happy with our staff and our board of directors. The other piece that our board is very excited about beyond transitional housing, which is the 2-year program where we want people to gradually pay more and more for their rent every month, and we pay for a portion of the rent. We also have a program called Eviction Prevention, and this program currently, we need more funding to run this program, and we're working on that piece. But Eviction prevention is one-time assistance for families or individuals who, for example, might have had a health crisis come up, or they might have had a problem with a car breaking down and they had to pay for the car repairs. So then they were delayed in making their rent payment, or were unable to make their rent payment for 1 month. And so that's families or individuals who are not homeless, but they are at risk of becoming homeless, and we need to provide that support for them for 1 month. It is the most harm-reductive way to help the families, and it is the best way in terms of taxpayers, because really you're paying less in the long run if you can keep them in housing.
Is that where probably your largest group of clients are?
Yes, it is, and it's a very easy program to administer when you look at it, because they don't need ongoing case management, they just need one-time help. It is the largest group that we support.
Now, about how many do you support throughout the year?
Throughout the year, typically we support 22 families in eviction prevention. That number is down a little this year because our funding has been cut back, our federal funding for that program. And then typically for our transitional housing program, the 2-year program, at any given time, we're helping about 15 to 20 families.
And as you said, you help them, it's like, I made the analogy once before, instead of giving them a fish, you teach them how to fish.
Yes, that's exactly right, Betty. That is the perfect analysis. What you do is you provide the fish so that the people can survive while they're trying to improve their skills and get out of homelessness and become stable and self-sufficient. But you're teaching them to fish while they're eating the fish.
Now, do you find the jobs for them too, or the training?
We do work with them on that. It's a partnership. They do the work. They do the work. They're out there applying, and they're going to the interviews and applying for jobs. However, our case manager works very closely with them, accompanies them on their interviews and to fill out their job applications. A lot of people work with the Workforce Center to try to improve their skills. So this is a major tenet of our program. And I'll be honest with you, I don't want to sound like a mean mama or something, but if you're not willing to do the work, you cannot be a participant in our program.
And that's, I think, what most people prefer, because you hear a lot of people talking about when people go on welfare, this and that.
Right.
There's abuses with that?
Yes. And this program will not tolerate that. If you commit fraud in our program, you're not going to be able to stay in our program. And you also will be removed from our program if you're not following the entire basic plan of our program, which is to work or to go to school. Now that is very, very rare.
But it's greatly appreciated that you have those kind of rules. But now you have a fundraiser coming up, and
we do.
Or an informational fundraiser?
It is. It's both. It's on November the 20th, and it will be starting at 7 o'clock a.m. at the Owatonna Holiday Inn. The event is free and open to the public, but people do need to call ahead so we can make sure we have a meal for you. And of course, you can give us a call at 446-9315. And let us know that you're interested. We have a wonderful series of speakers, people who've benefited from the program and have done the work to improve their own lives. I mean, people in our program, they work, they go to school. In fact, most homeless people work. That's the biggest misunderstanding that people have, is that homeless people don't work. And the people in our program that are going to be speaking are going to melt your heart, because they're going to tell you how they were able to transform their lives and the lives of their children. So once again, that's November the 20th at the Owatonna Holiday Inn. It is 7 o'clock, and it is free and open to the public. They just need to call ahead of time so we can make sure to get a seat.
So you have enough, yes. So
yes, and people are given a chance to make a contribution that day.
Now, and so if you have any questions or anything about that you want to know about the Steele County Transitional Housing, that's the day and time to head out there.
Absolutely.
Now, is this your major fundraiser?
Yes, it is our major
that's a
fundraiser.
Very important one.
It is. This is a significant way that we can support our day-to-day operations to keep people in housing and to keep people from coming into homelessness in the first place. And it's a wonderful way to learn about the problem of homelessness.
It's a lot of families.
It really.
That's when there's kids involved. That's really becomes even more important.
That's right, especially when there are children.
Is there a number they can call if they want some information?
Absolutely. Give us a call at 507-446-9315. We would love to hear from you.
Well, Julie, thank you so much for stopping by today, because, like we said, with the snow flying out there now, you start thinking a little bit more about those people who are, homeless or don't have a place every night to go to. It's more important now than ever.
Absolutely, very much, and I appreciate all of the help.
You're very welcome. So Julie Anderson from Steele County Transitional Housing has been our guest on the Owatonna Today Show. We're going to take this quick break, and then we'll come back, and we have some announcements we're going to pass along and then do a wrap-up.
Hi, I'm Amy Martinez.
And I'm Adam Martinez.
owners of Snap Fitness in Owatonna.
Snap Fitness is a fast, convenient, and affordable fitness center, and we're proud supporters of the Owatonna Today Show.
Here at the Owatonna Care Center, we strive to create an atmosphere of community and family. We have many family members who are highly involved in the care of their loved ones and the activities and events that are put on at the facility. There are many opportunities each month for families and residents to gather together for meals and various activities. We feel that it's important to make our residents feel like they are at home, whether they reside here long-term or they're here visiting for a short stay. We welcome community members to stop in at any time to be part of our community.
Hello, I'm Shawn McNulty with Brookdale Senior Living, Sterling House, and Clarebridge, and we're a proud sponsor of the Owatonna Today Show.
In 2011, United Way funded programs provided services to over 10,000 Owatonna residents. For the second consecutive year, the vast majority needed help to meet their most basic needs: food, clothing, housing, and safety. United Way of Steele County is able to sustain a safety net of direct services, prepare our children for the future, and provide seniors with support to age in place due to the generosity of our community. Please make a donation to United Way again this year. Our neighbors are counting on us, and we are counting on you.
We are back and do have some announcements we want to pass along. It's a busy time in Owatonna, lots of things going on. First of all, it started November 2nd. The Owatonna Yard Waste Compost Site will close at 5 o'clock every day now. It's open due to the early set of darkness. November hours at the compost site are 8 until 5, Monday, Tuesday, Wednesday, and Friday from 9 until 5 on Saturday. Owatonna compost site does close for the season on November 21st. That's the day just before Thanksgiving. And it will open the 2013, I should say, January 5th and January 12th to accept any holiday greenery as well as yard waste. Again, that is the Owatonna compost site. And the Steele County Historical Society will be having its annual meeting scheduled for Tuesday, the 13th, tomorrow night. The meeting will be held at the History Center. Space is limited to 128 guests. Tickets are $17 per person and can be reserved by calling the office at 451-1420. And coming up this Friday is the 22nd celebration for the Festival of Trees, a fabulous way to start off your Christmas season. It will be held at the Steele County History Center this year. It's a new location. 7:30 p.m. It is open to the public. Tickets are available at Hy-Vee, Cashwise, and Cottke Jewelers, and they're also available at the door. Again, that's this Friday the 16th, 7:30 at the Steele County History Center. And if you missed the Owatonna Farmers Market, it is now being held at the Eagles Club. So you don't want to miss your chance to get your cheese and your baked and canned and craft goods all winter at the Eagles Club from 9 a.m. until noon. And they started this past Saturday and will continue throughout the season. And the Bunko fundraiser is coming up, sponsored by the Cedar Chapter 123 Order of the Eastern Star, the 17th on Saturday. Doors open at 1:30. Bunko games start at 2 p.m. and ends at 4. $10 include bunkos and lots of good eats, they say. Again, that's Saturday the 17th, so lots of things going on around the area to keep you busy. We do want to thank you for joining us today on this snowy Monday, and we have lots of guests, great guests coming up for the rest of the week, so please join us on Wednesday. For Leanne Alt, I'm Betty Johnson. This is the Owatonna Today Show.